All right. So again, good morning. For this morning, we're going to learn about allergic rhinitis. All right. So allergic rhinitis. Rhinitis in general, no, is a condition without the allergic. So rhinitis is a condition wherein there is inflammation affecting the mucous membranes of the nose and upper respiratory system. So in general, no, you would probably be confused na kung ano yung magiging difference ng sipon, no, yung cold and flu, and also rhinitis. Now, this would probably be the three things that when you face a patient, no, tapos sasabihin niya na blocked yung ilong niya. Yan, so you would parang one way of assessing would be to line up, no, the different conditions that probably this patient will have. And so when you encounter these signs and symptoms, no, in general, we will be discussing more in specific later on, lalo na when you are going to assess the patient, whether he or she has rhinitis. No? But in general, you will find them with rhinorrhea, or there's nasal discharge, pruritus. Pruritus means itching, right? So ito, no, actually, ito isa sa mga importante, sneezing. Ayan, so bahing ng bahing. Normally, ang cold and flu, hindi naman nagsisneeze. Normally, kasi yung pag-sneezing is, pwede mo siyang i-associate as an allergy kapag, kapag medyo yung palagi, hindi yung parang nahatching ka lang once. No? But, yan, so parang paulit-ulit, tas makate sa mata, makate sa ilong, yan. So, you would, you can associate that with allergy, no? Ayan. So, there's also congestion or pagbabala, and there's also post-nasal drainage or drip. So, meaning to say, yung, parang, yung sipon, no, umaatras siya. So, nararamdaman dito sa likod, no, sa lalamunan. So, like this photo, umaatras yung mucus. Ayan. So based on epidemiology, I'm focusing on in Philippines that probably 2 out of 10 patients that you will encounter presenting these symptoms would be allergic rhinitis. Okay. So there are different types and causes of rhinitis. So again, no, removing allergic, no, so dalawang kinds. It could be acute, it could be chronic. So pag acute, so definitely ito yung should I speak in English? Sorry, I'm seeing foreigners. And Ma'am Jen, I'm sorry. If, for example, Miss Joko, can she understand me if I speak in Tagalog? Can you, or yes.
Yes, ma'am. I can understand you.
Okay. That's good.
My foreign students.
All right. I'm sorry. All right. If there are questions later on, because I spoke in Filipino, just ask me, or sometimes I forget. But anyway, all right. So, right, based on occurrence of the symptoms, if it's acute or chronic. So normally for chronic, if it's occurring for a longer time, no. So for acute, I think the maximum would be a month. But if it occurs more than a month already, then you could already consider that as chronic. So if it's acute, no, it could be because there is an encounter with foreign bodies, or it could be because of a viral infection, bacterial or fungal. There are also certain drugs that could induce rhinitis. So basically later on, I will also discuss it, but just to preempt it, for example, the cylometazidine nasal sprays, it is indicated for allergic rhinitis if you use it for 3 to 5 days, maximum of 7. But if you use it more than 7 days, there is what we call uh, a rebound congestion, no? So rhinitis medicamentosa, there will be a slide on it later on. So meaning to say that for a short period of time, it's safe for use, but if the patient uses it for more than 3 to 5, more than 7 days at most, no, for the nasal sprays, it could cause rebound congestion. I think even similar to some decongestants, no. So, for example, if you use brands with phenylpropanolamine, phenylephrine, those brands. I don't want to speak of certain brands of medicines, but yes, those decongestants, no, they're not supposed to be used for more than 7 days. And in fact, just for safety purposes, they should only be used for 3 days. Otherwise, if it's used for long, then your patient will have more congestion. So some conditions, if the patient is pregnant or if there's hypothyroidism, basically hormone related, it could cause rhinitis to the patient. Now we're going to chronic, no, again, for symptoms occurring for longer than a month. Basically, you have two types. It could be allergic or non-allergic. When you say, let's go to non-allergic, so NAIR stands for non-allergic rhinitis with eosinophilia syndrome. I think this is when, because eosinophilia is associated with allergies, but in this scenario, the doctor will diagnose it as still non-allergic in nature. Ayan. So, it could be NAIRS, it could be anatomic. So there are patients who have polyps and tumors or even septal defects in their nasal passages. So parang probably we could imagine it as parang bukol-bukol, no, na nandito. So that they are very easily triggered and experiencing congestion actually. So I've had an office mate before who suffers from nasal polyps, ayan, or idiopathic, meaning they don't know really the source. And there is also the allergic, which is when you are exposed to certain allergens. And so later on, I will show more types of allergens, common allergens later on. So if it's seasonal, meaning to say there are some patients who experience it for a certain period of months. So normally in Europe or in the US, kapag nag-change ng season, there will be a lot of pollens here and there, and that's when they experience the allergic rhinitis. If it's persistent, it means it almost occurs all year round. Ayan. So parang forever silang blocked nose. Okay, so for this session, we're going to focus only on the allergic. Okay, so I want you to understand that rhinitis, no, so it could be non-allergic, but it could be also allergic. Definitely, the treatment, no, if you're going to check the treatment, it could be the same, no, for the OTCs and even prescription medications that could be prescribed to patients. But definitely, for example, there are surgery options for nasal polyps that you wouldn't really recommend, or the doctors will not recommend to patients who have allergic in nature, no. Ayan. So diagnosis of allergic rhinitis, this is more for, so pag diagnosis, it's always associated with doctors, but you as pharmacists, we use assessment, okay? So basically, you have to ask, comprehensive and thorough history, no? So you ask, of course, you have to ask for all the signs and symptoms your patient is experiencing. Yung kaninang diniscuss ko, it doesn't have to be everything, no? It could be just 2 or 3 from there. Maybe there's no post-nasal drip, but still it would be allergic rhinitis, no? So just to keep that in mind. So ayan, no? So you could ask your patients, no, tuwing kailan, no, gaano katagal, how long, for how long do you experience these signs of symptoms? Do you notice if you experience this for example, is it from January to, depende yan sa location kasi there are some movement of pollens which I will share later. Again, na parang mas maraming pollen in this location, in this month. Yeah. So it's more of identifying the kung may specific month siya, no, na nag-experience ng rhinitis. Sa Europe kasi, no, there are 4 seasons. So kapag mas madali siyang ma-notice. But here in the Philippines, we just have 2, and again, no, parang it depends pa as well kung nasaan ka, ganyan. So nagvo-vary din. Ayan. So you have to ask if they notice, no, what types of exposures. If, for example, do they have cats at home? Do they have dogs? Do they have a lot of trees outside their house? Ganyan. So yun yung mga parang pwede mong i-explore if there are any patterns or chronicity. Again, no, exposure will be the trigger. Seasonal variation, again, tuwing kailan, patterns pa din. If there are any environmental influences, maybe the patient will just tell you, one time lang kasi may or parang ngayon kasi may construction dun sa likod ng bahay namin kaya ang daming alikabok. So alam mo na, no, na it's because of that. So yun yung mga pwede mong ma-inspect. Or allergies and other medical history, maybe it has been diagnosed in the past. So I want to share, that of course, apart from history, there's also allergen testing and there's also anterior rhinoscopy. So I just want to, sa next slide pa pala yun. But for example, other signs and symptoms that you should consider when sort of differentially assessing which if this could be a condition if this could be your allergic rhinitis. So allergic shiner, so normally ito yung so parang nangingitim yung mata, yung ilalim ng mata ng patient, and you have to differentiate this with also conjunctivitis kasi namumula din yung eyes ng mga patients with rhinitis. Ayan. So again, mas kapag may itching, ayan, so mas on the side of allergies yon. If there is crusting, no, pagkagising nila sa umaga, tapos hindi nila ma-open yung mata nila, no, tapos ang daming muta at naninigas na yung muta, then that could be bacterial or viral. So alam mo na hindi yon associated with your allergic rhinitis. It could be a conjunctivitis, no? Again. So again, it nangingitim at pwedeng namumula yung mata, but differentiate if it's an infection or an allergy. Okay, clear ba yon? Okay. Sige, hindi ko malalaan kung magsasausap kayo. Ayan. So next would be the neck, no? So of course you will not touch the necks of your patients, but sometimes you could check or ask them, no, na, di ba yung doctors normally parang hinahawak, pag check up ka, hinahawakan yung sa leeg na part kung matigas. So if it's lymphadenopathy, if naninigas, there's lymphadenopathy which suggests an infection, which could be a cause of the rhinitis. Ayan. So yun. So mas infection rather than allergic, no, kapag namamaga or parang matigas, no, yung sa bandang leeg ng patient. For chest and skin, ayan. So atopy, no, it's so yung term na atopy, it's an inherited tendency to develop a clinical hypersensitivity. So normally, no, pwede mong tanong kapag yung patient, there's also allergies, no, apart from the blockages, for example, in the skin, no, yung mga nagbubutlig-butlig, no, that could be eczema. So you have to, as a pharmacist, you can check and differentiate if it's an eczema or a psoriasis. So tignan nyo din yon. But if may history yung patient no, na lagi nagkaka-eczema siya, so you could associate, no, kasi normally kung meron siyang kumbaga skin allergies, then yung blockage niya and frequently occurring, no, could also be an allergic nature of rhinitis. Ayan, so again, I've mentioned, no, that if there is an anatomic or structural defects, no, dun sa nose, then that's non-allergic. And if there is purulent or bloody discharge sa nose, then that's a sign of sinusitis. So sinusitis is different from allergic rhinitis. Normally, pag sinabi ng pasyente sa inyo na masakit yung dito niya, yung, are you seeing me? Nakikita niyo ba ako? Yes.
Yes po.
Yes.
Yes, okay. Good. Ayan. So pag yung patient ay nagkukwento siya ng signs and symptoms niya, tapos sabi niya masakit dito sa taas and even dito, pag ganyan. So pag nag-radiate yung pain, then that's sinusitis. And if color ng mucus is yellowish, yan, so it could already be a sinusitis that is infectious in nature. So still, you could, no, upon presenting the symptoms, you could still give OTCs, but recommend that if it does not improve in 2 to 3 days, go to the doctor because you might need antibiotics na. All right? Does it make sense to you? Do you find my, at this point, very practical ba yung approach natin? Yes or no? Anyone? Okay. Sige. Sige. Can I see a thumbs up for people? Are you okay pa? All right. Okay. Sige. Okay. And so now we move on. So this is something that we do in the pharmacy in Malta. So we do allergy testing, but there are certain allergy test kits kasi na available. For skin prick testing and blood test, of course, that's not what we do, but just to preempt on the next slide. So these are the types of tests to confirm if your patient have allergies, no? So, for example, pag skin prick testing, so yeah, no, parang may mga solutions, different solutions, na prepared na i-inject dun sa skin ng patient, no? Ayan, so you look at this at the right side, ayan, so yung ini-inject nung allergologist, no, iba't ibang solution yan, and then if there will be a 6 millimeter classic wheal or flare after 15 minutes, then that would be a confirmation that the patient is allergic to that specific allergen. So just take note that you can't do the skin prick test if the patient has dermatitis or severe eczema. Of course, the doctor can ask for a blood test, to identify the eosinophil count and also the serum IgE. So basically, yung RAST or the radioallergosorbent testing. So this is parang one of the most used tests before. Ngayon kasi meron na tayong ELISA, which is also used. Diba? We know ELISA for HIV, but this one is for meron nang na-develop for allergies. So yan. So this is highly specific but somewhat less sensitive. So meaning to say, kapag na-detect niya, specific yon na the patient could be allergic, but if it's kumbaga parang less sensitive, could be that kailangan niya ng high amount bago ma-detect, no? So pag gano'n, no, marami kang false negatives na pwedeng ma-experience ng patient. So sayang lang din yung babayad ng patient. Okay. So ito yung ginagawa ko in the pharmacy. So this is something we offer in the pharmacy. So again, if the patient presents, no, napapansin namin pabalik-balik siya, no, na may allergic rhinitis or hay fever, no. Yun pala, it's another term for allergic rhinitis. So we normally recommend to conduct this in the pharmacy, and this costs 60 euros. Ayan. So what you do is you just prick, no, get an amount of blood, no, that fits this entire pipette. Ayan. And then you use all of these solutions, no, one by one with a specific time na pagkapasok mo siya dito sa plate, no, this is the plate and this is where you insert the solutions, ayan, after a certain amount of time. And then, so para siyang yung COVID testing or pregnancy test kits, ganyan. So lalabas yung mga lines, no? Kasi may control ka and then you will compare it against the control, ayan, and check if the patient is positive, no, dun sa certain allergen. So there could be, ayan, so as I mentioned, though, pwede siyang food related as well. Normally, yung mga nuts, tinatanong, mga pollen, and yung mga animal danders, no, yung balahibo. Ayan. So, in fairness to this test, no, so, ano naman, mataas naman yung accuracy niya. So, now we put in context into an algorithm what we have discussed. So again, a patient comes to you in the pharmacy and tells you, I have congestion, nag-sneeze ako, it's itchy, blah, blah, blah. You ask, has it been how long have you been experiencing this? 1 week or less? When did this start? No? And I would expect that, you know, Filipino patients normally, matagal na yan. Magsasuffer muna siya bago pumunta sa butika at mag-ask, no, or gumastos for medicines. So that was something then na yung baga parang na-bewilder din ako in the beginning kasi nga doon konting sakit lang, ganyan. Pupunta talaga sila sa butika to get help. So if the patient says, no, it has been a long time, actually lagi akong nagaganito every January or every, let's say, September kasi na yung pa fall na siya or pa spring pala, sorry, or no, spring. So spring is by March to May, fall. Basta change in seasons, yan. So, or pwede dito, no, pag papunta na sa tag-ulan, ganyan. So, ting pag tag-ulan, nararamdaman ko to, ayan. So, then you can say, no, na probably it's seasonal, kasi tuwing, mga June, ganyan, nagsisimula na, tapos nawawala naman pagkadating ng November, or, so that's seasonal. But when the patient says, actually, lagi na lang nga eh. So that would be your perennial. And then you would have to, actually, mas magandang i-refer mo na to kasi if, for example, pag lagi-lagi, baka tanongin mo lang din if may structural, may na-identify na before, baka may polyp siya, ganyan. But if ma-exclude mo naman yung sinusitis, again, the signs and symptoms I mentioned earlier, then it could just be a chronic perennial allergic rhinitis. Yan. So, if, for example, it's not chronic, no, first time niya lang ma-encounter, and the symptoms are unclear, think if you need a test, but if not, if it does not change anything, then naman, then so you can always give an OTC then But if you want to confirm, of course, it's if you have the test present in your pharmacy, you can always recommend. And ayan, no. But if not, try lang. For example, you can try. There's a saline din naman. But if it improves, if there's a positive response, then yes, it could be an allergic nature of rhinitis. So I'm just pointing out no na algorithms are very good starting points to learn how to assess patients. So yun yung value ng pagkakaroon ng algorithms, which I want all of you to to be familiar with. And if you're not familiar, find algorithms then, and it will help you facilitate how you can go about an assessment. So ito yung sinasabi ko na there are cases na, for example, there are dry months from November to May that peaks in summer, but specific to different cities, sometimes nagbabago-bago siya. For example, sa Quezon City, it's November, December, January. But in Los Baños high ang pollen between January, February, March, April to June. And then for the month of November. So nag-test sila dito, parang naglagay sila ng kinatch nila yung mga pollen sa roof. And then they counted for a certain period of time. So dito sa Philippines, ayan. So yan. So kaya it could change from place to place. So you could research kung may available na data dyan. Alright. So when you're going to treat for allergic rhinitis, your goal is to relieve the symptoms. I mean, definitely, you cannot cure it. So your goal is to just relieve the symptoms. And the first line, actually, the best that you could advise your patients, and this is non-pharmacologic actually, avoid relevant allergens and irritants. So kapag nag-test ka, so ma-identify mo yung specific na allergen, so alam mo na kung ano yung i-recommend, na avoid this and that. So, ayan. So, what you could also recommend non-pharmacologically, for example, sa beds, may mga bed covers na allergen impermeable. You can also recommend the use of the humidifiers because based on humidity, some people also get allergic rhinitis. So, kaya nauuso yung HEPA filters actually, kasi kumbaga parang dun sila yun yung selling point nila, yun yung marketing stint nila, that, when you use air purifiers at home, yung mga dust, etc. And, there are saying as well na, kumbaga parang nababawasan na yung alikabok inside the house. So, but there's no scientific evidence to this, so it could just be your judgment, or you can just recommend and tell them you can try this, but kumbaga parang hindi siya scientifically proven pa at this point, but anecdotes by patients na it helps them. So with if for example, it's pollen related, parang paano yun, parang so forever ka na bang hindi pwedeng lumabas, or parang for example, you're an outdoorsy type of person, so of course there would be sacrifices, and also you could advise just exercise indoors, you close the windows, pag humahangin, pumapasok yung pollen. The pollens are kumbaga mas nasa air siya from morning. So, they can do outdoor activities from 10 onwards. And if they go out, they change clothes. Kasi, syempre, di ba, yung mga ibang nag-teach-feed ng damit, lalabas sila. Now that it's pandemic, hindi na yan nangyayari, hopefully. But, pag lumalabas sila, dapat magpapalit, no, or maliligo kung napunta din sa hair. It helps. And then wipe pets after going outside. All right. So what I want you to always think about also are the red flag signs. So for every condition that you will report, you have to define the red flag signs unless it's a chronic one, no? Chronic. Yung mga NCDs na kumbaga, syempre kailangan talaga ng doctors. But say for example, when a patient comes to you and then they tell you na unilateral yung symptom or may blood. Pag unilateral, nasa isang side lang. Ganyan. No? Or there's blood. Normally, pag may blood, recommend yan, no? Na you don't risk it. Refer. And then if, for example, you have tried all of the OTCs or whatever recommendations that you have given, hindi pa rin siya nag-improve, then you should refer now to the doctor because then, it could be a structural abnormality already, something you cannot address. All right. So again, this is just an algorithm again. Same lang naman to sa kanina. But based on the severity of the signs and symptoms, nandito na yung what medications that you should recommend, no? If you have kumbaga parang kadugtong to pala nung kanina, sorry. So from the algorithm earlier, if it's a mild intermittent if the patient is experiencing mild intermittent symptom, or if it already affects, the daily activities in life, so meaning to say this could be moderate to severe or severe persistent symptoms. So the treatment choices are as follows. So isa-isahin natin yan later on. Ayan. So for what you can recommend as a pharmacist in the community in the future, of course, you have the second generation non-sedating oral or intranasal antihistamine. So yung may mga sprays kasi na antihistamine, like aldelastine. I'm not sure if it's available here. I have in the following slides actually. So yung but for example, yun nga, mas moderate to severe na yung symptoms, normally kailangan na ng corticosteroid na spray, and this is something that really works among patients, no? And in fact, my husband actually uses an intranasal corticosteroid. But if it does not help, no, then you still have options of adding. For example, you can add a nasal irrigation, or I don't know if you see this, may mga certain influencers na yung nasal, yung mga nasal irrigation, so saline lang yun, but of course it's isotonic, no, with the right amount of salt, and then parang normally it comes in sachets, tapos inimix na lang with water, no, na may bote, tapos yung parang irrigation, so papasok siya sa isang nostril and then lalabas sa kabila. So there are videos that I recommend that you watch. This is very helpful for babies. Yan, so maraming babies, pag nanood kayo ng mga videos, may mga babies na ninasal irrigate ng moms nila. Ayan, so there's also again, no, there's intranasal antihistamine. The oral, again, no, may oral dito, but if it's persistent, dapat intranasal para mas local yung effect. Otherwise, there's also subcutaneous or sublingual immunotherapy. Later on, again, we will discuss. So let's just jump into the different treatment options based on the signs and symptoms. So if the patient has ocular symptoms, meaning nangangati yung mata, and then there's also itching, nasa pharyngeal itching, nagsisneeze siya, there's nasal discharges and congestion, then the best recommendation is actually an intranasal corticosteroid. So again, based on the presenting signs and symptoms, no, para may checklist ka, ito yung the best na nasa left side, yung the best na pwede mong ibangga na i-recommend mo to your patients. But take note na actually yung mga nasal corticosteroids dito ay walang OTC. So sa Malta kasi may OTC, kaya may favorite ako doon lagi na binibigay, no, na gamot sa mga patients ko if yun nga, the previous medications don't work anymore, or if I notice that they always buy silometazoline. I think someone is parang maybe accidentally turned on the right. Turn off lang. Ayan, thank you. Ayan, so itong hinighlight ko ay hindi available sa Philippines. Alright? But still, for the purpose of being comprehensive, nilagay ko siya dyan. Sorry. Ay, nasan? Ala, bakit layo? Wait, sorry. Okay, so I just want to highlight and to remind all of you, probably encountered this already in pharmacology, but again, just to context, to repeat this, again, repetition is key for mastery. Even as pharmacists, actually yun yung problem pag hindi mo laging ginagawa, nakakalimutan mo din. Kaya dapat laging inuulit and you don't get tired of it. Just, read again, and you as students most especially. Yan. So these are your oral antihistamine, second gen. Ang first gen, again, ang mga first gen, mas nakakaantok kesa sa second gen. Tama? Yan. So, of course, to let them go about their everyday activities, it's better to recommend them the second generation. And I've listed all the available dosage forms and those strengths then na available. I've also highlighted which ones are prescription. So si fexofenadine, it's a prescription. Okay? So all the rest, you can, cetirizine, loratadine, and desloratadine, you can recommend without thinking na kailangan niyo pa ng reseta. It's normal, no? So the first things in mind, no, when syempre hindi naman to naturo sa akin din before, but again, no, to highlight na yung antihistamines, they could be used for long term. Actually, parang I think I've seen patients using this for more than a month or 2 months, ganyan. So sa prescription ng mga ng mga doctors. Ayan. So, yung kailangan nyo din gusto ko i-highlight sa inyo is when you recommend, take note yung minimum age of use. So, for cetirizine, it starts from 6 months, no? And desloratadine syrup, so yun yung 6-month-old baby, you can recommend. But, for example, loratadine, no? And also yung fexofenadine from 2 years old and above, sila pwede. Okay, normally these are taken at night because histamines are produced at night, no? Para silang cholesterol. Sa gabi yan na-form or sa gabi, so kaya palang yung effect para sa morning, hindi sila nag-experience ng signs and symptoms. But for severe conditions, there are doctors who recommend na twice a day. So, but there normally for you, your limitation, no, you should sticks to the once daily dosing. Okay? So yan. Yung difference din, no, bakit yung loratadine and desloratadine, no, bakit magkaiba pa yung month, yung starting age, no? So just to highlight that loratadine is faster to reach Cmax, therefore there is higher central nervous stimulation compared to desloratadine. So it's so much safer na yung desloratadine ibigay sa mga bata kasi mas mabilis maka-reach sa brain si loratadine. So, kung ikaw ay laging nag-antihistamine, you cannot drink alcohol to the brink. Kumbaga parang basag na basag ka na, no? And I think I've computed this. I think, for example, for Smirnoff, I think maybe 2.5 bottles yata yung computation. Kinompute ko to last time. So, you can find, if you want to help your patients, no, ganyan, baka tanungin kayo, pwede ko bang pagsabayin, ganyan. So, hanap kayo ng guides, no, compute nyo yung alcohol based on the alcohol content, and if it will reach point approximation lang naman, no, 0.5 gram per liter, no, in the blood levels based on your approximation, yung equivalent ng alcohol content sa iinumin niya. Ayan, so you can advise, no, na maybe less than this, ganyan. So of course, you have to ask as well, you don't give antihistamines to patients with glaucoma. Caution in epileptic patients. Actually, there's also asthma, but so yun, kasi nga sa actually ang antihistamine, it's both stimulation and also the opposite, no? So depression. So pwedeng yung effect hindi maganda yung maging effect sa patients with asthma, but there are certain conditions din naman kasi nga the triggers are allergic, but still again, this is something just for caution, no, na kung magde-decide kayong magbibigay, no, you have to be cautious, no, if the patient has asthma or has renal impairment, so that if there's renal impairment, you can assess for dose adjustment if needed. And so take note that this does not necessarily address nasal congestion, but di ba kapag kaya yung mga certain brands, no, may chlorpheniramine plus phenylephrine, and there's also may chlorpheniramine, phenylephrine, and paracetamol normally, di ba? So may anti-allergy ka, meron kang decongestant, no, because it cannot address nasal congestion, no, so it will take time for the patient to kailangan niyang ma-deplete muna yung histamine inside the body, so it will take longer. So for oral antihistamines, I hope you've learned in the past that this is best to take in an empty stomach, mas faster yung effect. Just another highlight, fexofenadine cannot be used with antacids. There should be 2 hours interval. Ayan. And then cetirizine interacts with theophylline. So again, patients with asthma. So yun, no? Kaya kailangan mo rin talaga i-check kung ano yung medications na iniinom sa asthma ng patient kasi it could be a contraindication to the medication na iniinom ng patient. Sige, medyo bilisan natin. So, for intranasal sprays, ayan, so I want you to watch this video, but just to highlight, no. So again, I mentioned that my husband is using sprays, and we have a lot at home actually. So just for demonstration purposes, it's much better to see actual products in real life, no, hindi yung nasa video lang. So kaya kayo nag-internship para mas ma-imbibe ninyo, no? Yung mas magkaroon din kayo ng confidence when you teach patients. So, for example, so this is a mometasone, no, na nasal spray. So, take note, no, na, of course, this is the corticosteroid na spray. May mga patients na tumatawag or they come to the pharmacy parang feeling nila wala namang gamot na lumalabas. But they have to ask nung binubuksan mo ba yung and it happens, so binubuksan mo ba kasi may cap siya, so iba hindi nila binubuksan. So again, no, meron pa tayong xylometazoline, which is the OTC, but most pag steroid and antihistamine yun, hindi yun normally, no, hindi siya non-prescription, so you need a prescription. There's also a saline. So sa saline na lang yung pagpapractice natin. So the first thing is have to tell your patients to prime, no, the spray, because you don't know kung lumalabas yung gamot. So tingnan mo, sabi niyo makikita, but definitely, no, in the first spray, parang walang lumalabas. So kaya dapat i-check kung may lumalabas ba talagang gamot, no? So if the patient has not used it for a long time, or if it's the first time to use it, kailangan i-prime. So basically, when the patients use this, so as a demonstration, no, so dapat una hindi sila nakatingala, kasi kapag nakatingala sila, yung gamot mapupunta sa throat. So they will experience bad taste. Ayan. So when they use this, so you have to use, no, so kung sa right ka mag-administer, hawakan mo yung pisngi, no, you have to move it to the right, and then, no, using your other hand to spray, pointing it, no, to the direction, hindi pa ganon. Ayan. Tapos, when you spray it, wait for 1-2 seconds, saka i-breathe in. All right? So hold the cheek, pasok in this angle, and then spray. And after 2 seconds, breathe in, no? So ganun siya gamitin. Yun. So yun lang naman yung mga major, and I think you have to again, if it's a xylometazoline, highlight that they cannot use it for more than 7 days. And if you want to be more conservative, hanggang 5 days lang, only for 5 days. All right, so these are your intranasal corticosteroids. The ones in gray, yun, hindi siya available dito sa Philippines. It's not available in the Philippines. But we only have 2, no? 2 out of 1, 2, 3, 4, 5, 6. Out of the 6 intranasal corticosteroids available in the world market, no, at least, or in Europe, only 2 are available in the Philippines, and this is your Avemis or the fluticasone and the Nasonex or Rhinomet, or this one is Mosa spray, no, yung isang brand. Ayan, so just to highlight, minimum age of use again. Remember, always minimum age of use. So how this is used is for the fluticasone, it's 2 puffs each nostril in the evening, and the maximum of 4 for each nostril. And if the patient, no, has relief na, again, this could be used for long term for an entire season, then if the symptoms is already controlled, then if the symptoms are already controlled, then the patient can use it 1 puff each night lang. For mometasone, you can mas lesser yung puffs dito, 1 puff, maximum of 2. But if the age of your patient is from 2 to 11, again, so you cannot do more than 1 puff for each nostril. Ayan. So basahin nyo na lang yung mga review parts, no, the mechanism of action and initiation and monitoring. One of the things lang din, no, in the next slide, I have, di wala pa, but I have nasal spray na saline. So, sometimes the pharmacist or the doctors will recommend to start with a saline to clean first, no? Parang ipapablow mo muna siya bago siya mag-start. But sometimes it's too blocked, no? Masyadong madaming sipon or mucus. So, i-clear mo muna siya with a saline, saka mo gagamitin yung steroid mo for, syempre, mas less yung kailangan mong puff, mas less yung, to be conservative, mas less steroid siya. But you don't have to worry as much kasi diba, steroid is always associated with metabolic side effects. So local naman to, so hindi naman siya systemic yung absorption. So you don't have to worry as much. Ayan. So for antihistamines, ayan, actually available siya. So good job, Philippines. Ayan. So we have a Zelestine nasal spray. But for combinations, so we have the Azelastine plus fluticasone. And for the intranasal anticholinergic, ciprotropium, it's not available. In Europe, no, in practice, ito yung the best. Parang pag wala ka nang magamit, ito na yung parang highest or parang pinaka-last resort ng mga doctors, yung Dionista. And this is very, very good. Yun, unfortunately, it's not available in the Philippines. All right. So again, your oxymetazoline or xylometazoline, this is your alpha-2 agonist intranasal spray. It's just again, no, decongestant siya. So when again, no, the thing that you have to memorize talaga yung mga basic medications and how to use them, when to use them. Always, no, there's a pedia formulation and there's an adult formulation, and don't mix it up. 1 to 2 puffs each nostril for 3 to 5 days. There are some references who will tell you 7 to 10. There are some doctors that will be conservative until 7. So iba-iba yung practice. For you, kung saan ka comfortable, but I would be more conservative kasi nga it's your patient's life at stake. Ayan. So again, the rhinitis medicamentosa, this is the rebound congestion if you use it more than the recommended number of days. Okay. So for saline spray, again, this is very safe, even used from birth, kaya lagi yung mga babies. Ayan, so nire-recommend. Actually, kahit saline nasal spray lang, sobrang mahal niya. Like, there will be cans na parang 500 or 700, depende, no? Kasi may mga versions na parang puff lang din talaga siya. So, katulad nito, this is Sterimar. I think meron tong mga ibang ingredients like copper or manganese, ganyan, for allergies. But, yun nga, parang may mga versions na nakakan, tapos parang malaki, ganyan. So, depende din, you have to be careful because there are patients complaining na masyadong yung pressure sobrang lakas, tapos masakit sa ilong nila. Ayan, so definitely I will not give, unless it's in the package that it says for a baby. Yan, you have to be careful kasi yun na, baka masyadong malakas yung pressure and mas ma-irritate yung nose ni baby. Ayan. Tapos sa sipon. So ito yung isang, again, no, as an adjunctive treatment, I will just let you watch this on your own. But basically, if the allergens, no, are lodged dun sa nose, so kapag in-irrigate mo, ayan, so parang you are mechanically removing the pollens or whatever allergens packed in the nasal passages, at mas makiklear siya, no, yung ilong ng ating patient. So you can also recommend oral decongestant. This is something that, very, very widely used in the Philippines. What I want you to to remember as pharmacists, no, nakikita nyo naman vasoconstriction. ang mechanism of action niya. And if there's vasoconstriction, take note that this is not recommended for hypertensive patients, especially if it's not controlled. So kapag may mataas ang blood pressure ng pasyente mo at pinainom mo pa siya ng phenylephrine or phenylpropanolamine, you can affect the blood pressure, and if it's uncontrolled, baka ma-stroke or ma-heart attack ang pasyente mo. Kasalanan mo yon, okay? Hindi mo man alam. That's the problem. We don't, normally, people will not realize kasi hindi naman nila ma-identify na yung binigay yun ng pharmacist. But you have to be careful because, again, you could be harming your patients more than helping them. All right. So again, do not give this to hypertensive patients, especially if it's uncontrolled. You could decide to give this for those who have controlled, very controlled ang blood pressure nila. I mean, high blood sila, but they're on medicine. There are pharmacists who feel comfortable to do that for a short period of time only, but you don't give it, again, these are not medications used for more than 7 days as well. So, yan. So, something to highlight. Okay. So, this is something na hindi din very common and only doctors can prescribe. So, they can add on montelukast or a leukotriene receptor antagonist or an oral corticosteroid. So, for babies, ito mga or children, may mga sublingual or candy version. Ayan. So, take note that, for example, ang montelukast, may black box warning to, na there is a risk for severe mental health side effects, including suicide ideation, or a potential change in behavior or mood. So you have to warn patients if a patient is going to use this for long term, na to monitor their kids. Ayan. So parang recently lang yan nilabas ng US FDA. For prednisolone or any oral steroid, take note that it has to be taken after meal, ideally in breakfast. If this is taken in the evening, one thing you have to remind them to take it much earlier. So parang pwede silang mag-snack siguro ng or 4 or 5, something like that, kasi nga it can cause insomnia. And so if it's going to be used for a short period of time, don't worry about metabolic side effects. And kasi normally it disrupts sugar, yung mga thyroid hormones, ganyan. But for a short period of time, it's okay. Ayan. So these are the products na pinicturean ko before coming back here. Ayan. So ito yung nasa court na OTC na binibigay ko to patients. And sometimes I forget them kasi pag foreigner yung face, tas parang feeling ko minsan magkakamukha sila. Much as they look at us, parang feeling nila magkakamukha lang tayo lahat na Asians. So hindi ko sila natatandaan, and then they will say, "Oh, you're the one who recommended this to me." Ganyan. It was very good. This is my second spray na ganyan. So this is the Avamis, and this is the Nasonex. So meron pang ibang brands din dito, like I mentioned sa mometasone, there's Rhinomet and Masomet. Maso spray pala, Maso spray. Okay. Ayan. And then the different brands available. So I tried to present as much products, as much photos, kasi yung learning din, lalo na hindi kayo masyadong nasa butika. So if you have versions, or you have take as much photos as you can from the internet just to show and demonstrate, kasi mas nakakatulong siya sa learning. So again, for combination therapies, for example, for me, if for the patient will tell me na kumbaga parang mild or intermittent lang, I can start with an oral decongestant with an antihistamine. Normally, ito yung mga non-drowsy version dito, no, na hindi, pag non-drowse, wala yung antihistamine. Wala kasi dito yung mga brands na dinidispense ko. But, yes, you can decide, for example, yung mga BioFlu, ganyan. Kasi may antihistamine yon at mayroong decongestant, okay? And they can use it for 7 days and then switch to cetirizine after. No, 7 days lang yung may decongestant, and then switch them to an oral antihistamine. Or you can make a combination of a topical decongestant or a saline spray, and then an antihistamine. So you can give an OTC na intranasal corticosteroid, or you can sometimes even yung sa Malta actually binibigay namin yung Flumosil dito and acetylcysteine. Ayan. So ginagamit din siya kasi na pang break nung mucus. Ayan. And then also there's vitamin C to help them boost the immune system. So what I want to highlight here is you're not wrong to choose between one or the other from the options, as long as it's very clear to you why you are recommending it. Okay? And you stick also to OTCs. No, don't give them prescriptions. Prescription drugs. Basically, because that's not the way it works. You are putting yourself as well in possibly, there could be legal repercussions against you. But it's up to you still, no? If you think that, there are instances na wala talagang choice, maybe it's a Sunday night, no? So it's going to be your clinical judgment. It's going to be your call. But always try to think, no, yung safety ng patient, what will happen to the patient, what if you do not do, or if you're not going to act, or parang yung best judgment mo. No, but always stay on the side of safety, both for your patient and for you as well. Okay? Ayan. So, wag din, kasi madaming mga pharmacists ako na-encounter na parang, ay, si Doc, tanong mo na lang si Doc. Ganyan. So, hindi yan excuse. Again, you have to understand, you have to know your options and give them the best option based on your judgment and based on what you are allowed to do. So for severe persistent, ito yung normal na pwede nyo ma-encounter in a prescription. Alright? So this is just to give you the subcutaneous immunotherapy. Ito na yung sa severe persistent, yung sa pinaka-last na kumbaga parang dun sa algorithm earlier that I showed you. Ito na yung sa last resort na ng patients natin, or those who have, affecting their lives already. Ayan. So this is a repeated dose of a specific relevant allergen na ini-inject subcutaneously para siyang skin prick testing, but this one is more much more frequent. It's essentially desensitizing the patient from a specific allergen. Ayan, so so maraming mga parang solutions prepared. It depends kung saan ma-identify. So they could start with a skin prick test, and then dun sa mga nag-positive, if it's something na unavoidable, something that the patient cannot do anything about, probably maybe their house is located somewhere na kahit na patanggal niya lahat ng puno sa lot niya, hindi naman niya pwedeng patanggal yung puno ng kapitbahay, parang ganyan. Alright, so this one, the difference lang, this one's administered sublingually and actually much more, much more convenient because this one is either dissolved in water or it comes as an aqueous liquid extract. All right. So again, nabanggit na natin to, no? Differentiating allergic rhinitis from sinusitis. And if you give the same treatment recommendation, it's okay, but you have to tell them to check with the doctor in 2 or 3 days if the symptoms still persist, because it could be that they need an antibiotic. And so as a summary, so we have to assess if the conditions being presented, the signs and symptoms being presented to you is allergic rhinitis, and if you can treat it, no, maybe you have to determine if this is another condition or not, and if your patient requires referral based on the red flag signs I've mentioned. So again, the term, i-check nyo lang lagi severity of signs and symptoms, as well as the frequency of occurrence para ma-identify nyo yon. Yung comorbidity is important because if your patient is probably taking certain medications and it will be contraindicated to the medication you're going to recommend, diba? So you have to check that part. Also ask if your patient has done any previous allergy tests and if he or she has taken previous medicines, because you should not recommend the same medicine again because definitely it's not working for them. And again, age is important kasi nga iba-iba yung minimum age ng mga medications natin. Ayan. Again, this is the treatment algorithm. So meron tayong assessment algorithm, may treatment algorithm based on whether you have what type and the occurrence. So yan yung mga options natin. All right. So I will send a copy of my lecture. This is actually 30 slides lang, and actually, how long? Ayan, actually, ang tagal ko pala. Well, less than 2 hours, 1.5 lang ba? Ayan, so, ayun, I will just stop the recording for now.